Welcome, everyone. Before we begin today's webinar, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on, is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. My name is Tracie Napoli, Director of Fund Development and MARCOM at Osteoporosis Canada, and I will be your webinar host. Today's Osteoporosis Canada presentation is on exercise recommendations in the new Osteoporosis Canada Clinical Practice Guideline with Dr. Lora Giangregorio. We thank our webinar partner, the Collins Stevens Family Foundation, for helping to make this program possible. This webinar will provide general information. It is not intended as individualized health or exercise advice. If you have questions, consult a physician. Now, if you have questions related to the webinar, you can click the Q&A icon at the bottom of your screen or enter your comments in the chat. We will do our best to answer as many questions as we can during the webinar within the time available. Osteoporosis Canada is the only national organization serving people affected by osteoporosis, working to educate, empower, and support individuals and communities on bone and muscle health and in the risk reduction and treatment of osteoporosis. We look to the best experts to inform our care guidelines for patients and care providers. Our Scientific Advisory Council, the SAC, is made up of experts from across the country in osteoporosis and bone metabolism and is a volunteer membership. Comprised of clinicians, researchers, and educators, the SAC advises Osteoporosis Canada's board and staff on scientific and medical issues. Our organization provides medically accurate information to patients, healthcare providers, and the public. Services include programs and support groups, educational webinars like this one, podcasts, digital tools and resources, which are all available at osteoporosis.ca, along with community resources. It is now my pleasure to introduce our webinar presenter, Dr. Lora Giangregorio. Dr. Gregorio is a professor and Schlegel Research Chair in Mobility and Aging in the Department of Kinesiology at the University of Waterloo, and an affiliated scientist with the Schlegel UW Research Institute for Aging, the University Health Network, and the Geriatric Education and Research in Aging Sciences Center. Please welcome Dr. Lora Giangregorio.
Okay, can you see my screen okay?
Yeah, you just may want to put it on there we go, wonderful.
Yeah, great. Okay, thanks for having me today. I'm really happy to be here, and I'm going to talk to you about the exercise guidelines. So I'm just going to, sorry, this is not going forward. I'm not sure. There we go. So in 2023, the Clinical Practice Guideline for the Management of Osteoporosis and Fracture Prevention in Canada was published in the Canadian Medical Association Journal. And this guideline is designed for healthcare providers to inform how they prevent or manage osteoporosis in their clinical practice. And this is an update from the 2010 guideline and includes recommendations related to exercise, nutrition, fracture risk assessment, medications, and monitoring. And so today what I'm going to talk about is the exercise part of the guideline, so I won't be talking about the other aspects of the guidelines. And so in brief, this is how we developed the guidelines. So we started with working groups. So there were working groups related to exercise, related to nutrition, related to risk assessment, medications. So I led the working group that developed the exercise recommendations, and we came up with the types of questions that we wanted to address with the recommendations. And then we did reviews of all of the evidence that exists related to those questions. We looked at the quality of the evidence and the benefits and harms, and then we considered things like preference, equity, and feasibility. And based on all of that information, we came up with the recommendations. So today, what I'd like to do is briefly review some of the evidence when it comes to the effect of exercise on fractures, falls, bone mineral density, posture, physical functioning, and quality of life. And then I'll talk about what the exercise recommendations are based on that evidence, and then talk about some practical tips on putting the recommendations into practice. So we'll start with what is the effect of exercise. So, and I'm going to go through it by outcome. So the first outcome we looked at is fractures. So if we looked at studies that looked at whether or not exercise could prevent fractures, now most of the time the studies aren't designed to look at that question because you need really large exercise clinical trials. However, there are a number of trials that have looked at the effects of exercise on falls, and they also record fractures. And when you start pooling those studies together, you can start to estimate whether or not exercise can prevent fractures. So, and the researchers that did this type of work, where they reviewed all the literature and looked at falls and looked at fractures, they actually looked at it by exercise type, which is really helpful because then we can understand what types of exercise are effective. So what they found was that exercise programs that targeted balance, coordination, and physical functioning. So they designed the exercises to improve balance or physical functioning. Those types of exercise programs were very effective for preventing falls, and they may also be effective for preventing fall-related fractures. And the reduction in fall-related fractures was approximately 56%. And this is based on the pooling of data from 7 studies with 2,100 participants. When they looked at other types of exercise like walking, Tai Chi, resistance training, and other types of interventions, there either wasn't an effect or there wasn't enough studies to estimate an effect. So we can't say with confidence that those types of exercise prevent fractures. But we do know that we can prevent falls and fall-related fractures with exercise programs that target balance, coordination, and physical functioning. And similarly, when they looked at falls only, it's a similar message. So the types of exercise programs that can prevent falls, again, are those that target balance and physical functioning, as well as multi-component programs that combine balance and physical functioning exercises with other types of exercise, most often resistance training. And in fact, those were some of the most effective programs. They reduced the rate of fractures by 34% and the risk of being a person who's had falls, not fractures, the rate of falls by 34%, and the risk of being a person who's had a fall or has a fall by 22%. Tai Chi was another one that was effective for preventing falls. So those types of interventions are effective if we're looking at falls as an outcome. And again, when they looked at other types of interventions like dance, resistance training, walking, and other things, there either wasn't enough studies to estimate an effect or the effect was not statistically significant. When we look at interventions that are effective for improving bone mineral density, we actually did systematic reviews looking at yoga, Pilates, balance and functional training, resistance training, walking, impact exercise. We looked at all the different types of exercise. And a lot of times when we actually looked specifically for studies that included people who have low bone density, because a lot of the studies are looking at healthier people in the sense that they have normal bone density or they're younger, but they're not looking at people who have low bone density. So when we restricted it and looked at what do we know about the effects of exercise in people who have low bone mineral density, there actually are not that many studies. So there's no randomized trials of yoga. So we can't conclude that yoga can improve bone mineral density. There were few to no trials of Pilates. And then the studies that looked at impact exercise by itself, there was only 2 studies. Walking, there was only 1 study. And so what we can conclude is that the studies that have shown an effect often combine resistance training with impact exercise. So there is some evidence that programs that combine resistance training with impact exercise may improve bone mineral density. Now, that said, there's a small number of studies, and I think we do need to do more studies before we can answer this conclusively. But if your goal is to improve bone density, probably your best bet is to combine resistance and impact exercise. And we can't conclude, despite the fact that you'll see all over the internet that, you know, yoga and walking and all these things can improve bone density in people with low bone mass, there's actually not that much evidence to suggest that's true. And it's more so that we just don't have the studies, but also perhaps it may not be an intense enough type of exercise to change bone density. A lot of people will ask whether or not they can improve their posture with exercise, and people, particularly people who have what's called hyperkyphosis or an exaggerated kyphosis, so the upper part of your back is a bit rounded. And so there have been studies that have actually looked at exercise programs designed for people who have kind of a rounded upper spine, and they found that exercise programs that target the spinal extensors, or the muscles that extend your spine. So if you think about, if you sit up straight right now, you'll feel muscles in the middle of your back working. That's what I'm talking about. So when they exercise programs that target that and physical functioning can actually improve posture by a small amount, as well as reduce pain and improve physical functioning and quality of life. So the general message is, if you want to improve posture, you want to add exercises for your back extensor muscles and abdominal muscles, as well as the muscles that stabilize the shoulder. When we looked at the outcomes of physical functioning and quality of life, we found that many exercise types can improve physical functioning and quality of life. So if that's your goal, then you want to try to do the types of exercise that you like to do, and you probably will have some benefit when it comes to those things. The other thing is, we looked at harms, and in general, you know, the risks associated with exercise seem to be rare, although it can happen. There are isolated incidents where people have a fracture due to exercise, or they strain a muscle, or experience muscle soreness, or have other minor injuries. So it is possible to injure yourself. So you do have to be cautious and accept the fact that there is some risk associated with exercise, just like there's risk associated with walking, you know, on an icy sidewalk, or, you know, doing other types of activities. We can, you know, many falls and fractures occur in the home doing daily activities. So, but there is some risk, so you do want to take precautions and progress your exercise safely. So if we look at those key points from the systematic reviews, we can say that balance and functional training with or without resistance training can prevent falls and may prevent fractures. Resistance and impact exercise may improve bone mineral density. If you want to improve posture, you want to include exercises for back extensor muscles and shoulder stabilizers. Many types of exercise will improve physical functioning and quality of life, and adverse events or side effects seem to be rare. So the next step is, based on all of that information, what are the exercise recommendations? So the first recommendation is that we recommend balance and functional training at least twice a week to reduce the risk of falls. And in fact, the research suggests that if you really want to, the most effective programs, exercise programs, have people doing some type of exercise for 3 hours a week or more to be most effective. So that's a strong recommendation, that we recommend balance and functional training at least twice a week. The second is that we suggest progressive resistance training at least twice a week, ideally also including exercises targeting abdominal and back extensor muscles, as well as muscles, the shoulder stabilizing muscles. We also suggest that people who want to participate in other activities for enjoyment or other benefits, that they be encouraged to do them if they can be done safely or modified for safety. And part of the reason for this recommendation is to make sure we're not promoting fear. So the idea that, you know, people shouldn't, clinicians shouldn't be telling their patients that, you know, to not be active or not do things because of fear. Now, that said, we do encourage people to do things for fun and fitness if they want to, as long as they can be done safely, or modified for safety, but also that they do them in addition to and not instead of balance functional resistance training, because those balance functional resistance training, if your goal is fall and fracture prevention, is what you want to do. Now, some people may be really motivated to try to improve their bone density or try to maintain their bone density, and they may want to add impact exercise to their resistance training. And my advice there is, I think that's fine. I think the idea, though, is that you want to make sure that you do it safely. And so we don't want people who've never done impact exercise before to all of a sudden start doing drop jumps, because you want to condition your body to be and make sure that it's safe for you. So we usually, and I'll have some tips about how to do that, but the idea is that you want to progress to moderate impact or high impact only if it's appropriate for your fracture risk or your physical fitness level. So for people at high risk of fracture who've had multiple vertebral fractures, it may not be safe for them to jump into high impact exercise, right? Whereas people who've never had a fracture, maybe on the they have low bone density but have not had a fracture, they might be able to slowly progress towards moderate or high impact. So it's a bit of a continuum. It's not a yes, no. The other thing is that we included some good practice statements. So the types of activities that are risky, the ones that typically cause fractures. One is falls, is the most common cause of fracture. So we want to make sure that we do what we can to reduce the risk of falls. And the second is avoid rapid, repetitive, sustained, weighted, or end range of motion, twisting or flexion of the spine. So either avoid it or remodify it, because those are the types of movements of the spine that might be a bit risky, especially in people at high risk of fracture, like those who have had existing hip or vertebral fractures. And when available, you want to seek advice from an exercise professional who has training on osteoporosis. And that exercise professional can help you choose exercises. They can help you decide on the intensity and also progressing the exercises, or how to modify activities if they're risky for you. And this is especially important if you've had a recent fracture or if you're at high risk of fracture. If those resources are not available to you, then you want to try to educate yourself with Osteoporosis Canada resources or other resources that are evidence-based. So to summarize the recommendations part, we recommend balance and functional training at least twice a week. We suggest strength training at least twice a week, and that's also consistent with our national physical activity guidelines. We also suggest that you do activities for fun and fitness that you enjoy, in addition to, but not instead of, balance and functional training if they're safe for you to do. Some movements may need to be modified or avoided, especially if you're at high risk of fracture, and those include the activities that cause a high risk of falls, or those that involve flexion or twisting of the spine when it is rapid, when it is repetitive, when it is done holding a weight in your hands, when it is sustained, so you're in a flexed position for a long period of time, for example, or when it's end range of motion, meaning you're bending all the way forward or you're twisting all the way around. And when available, seek advice from exercise professionals who have training on osteoporosis. So the third part of the presentation is, how do we put this into practice? So this is the practical thing. So what does this look like? So the first thing is, I mentioned balance training and I mentioned gait training, and I wanted to define what I mean by that. So gait training is things like correcting walking technique. So in people who have balance and mobility impairments, they may need to actually practice walking with a particular stepping rate or posture, or working on changes of pace, level, and direction. So for example, sometimes people really struggle when they have to change direction quickly or turning, so they may need practice with those sorts of things. Balance training is being able to transfer your body weight from one part of the body to the other, or doing activities that challenge your balance systems, or doing functional movement patterns or dynamic activities that target all different aspects of balance. So I'm going to get into some examples of those. And then the other term I used is functional training. You'll see this all over the internet. And functional training is essentially exercises that are similar to an activity you want to get better at. So if you find it hard to go upstairs, then you might do step ups to try to get better at getting up, get better or stronger to be able to do stairs. If you find it hard to get out of a chair, then you might do sit to stands to build your strength for that. there's a lot of overlap between functional training and resistance training, because often to improve function, we have to improve our strength. So we might choose resistance training exercises that resemble the types of movements that we might do every day. And so that's where there's a bit of overlap. And some people argue that resistance training is functional training. I'm not going to go into those arguments, but the one key distinction is that functional training really is about practice and improving strength or agility to be able to do a specific activity. So it's kind of training for something. So if I wanted to get better at tennis, I would play tennis, but I would also do tennis related drills. That's functional training specific to tennis. Resistance training is very specifically doing exercises where you are contracting muscles against resistance, and you go to overload, meaning that you do the exercise until your muscles basically fatigue and you can't do anymore. So functional training doesn't always involve overload, but resistance training does. So those are some key distinctions if you see those terms. So you're using weights or elastic bands or working against gravity, working against resistance until your muscles become very fatigued to the point where you maybe can only do one or two more and then you're done. So I did mention, so let's now break it down. So the first recommendation was balance training at least twice a week. So what types of balance training are most effective? So there's sort of 4 categories that I want to talk about. So anticipatory control is the first category. This is when your anticipatory control is your ability to, like when you're faced with a position or movement that makes you a little unstable, that you're able to proactively move or shift or change position to regain stability. So a good example is if I go to stand on one foot, I automatically transfer my body weight. I automatically shift so that I don't fall over, right? Or if I go up on my toes, and I automatically kind of lean backwards a bit to avoid pitching forward, right? So that's your body using its anticipatory control. And people who don't have good anticipatory control might fall over if they tried to stand on one foot, for example. Dynamic control is your ability to stay stable when your body is in motion. So I use the example, you know, if you've gone to Oktoberfest and polka dancing, you have to kind of dance from foot to foot and spin around. And so your body is constantly in motion, and your ability to stay stable and not lose your balance during the dancing is an example of dynamic control. Or if you're getting out of a chair, you shift your body weight forward, and your ability to not kind of pitch forward and fall out of the chair is another example of dynamic control. Functional stability limits is your ability to stay stable when you move as far as possible in any direction. So if you lean forward and you are able to stay stable and not fall forward, or lean to the side, for example. Reactive balance control is, actually, I'm going to go back to the functional stability limit. So if you think about in a time where you were reaching up into a cupboard, right? And you know, you're leaning forward. Now let's imagine you're doing that while also on a ladder or something. You can see how, you know, there's going to be a point where you reach a limit of your stability and then you lose your balance, right? So functional stability limits is kind of working on how far your limits are when it comes to your ability to stay stable. Reactive balance control is those scenarios where you have lost your balance and you're able to reestablish stability instead of falling over. So again, I'll go back to Oktoberfest. If you're doing your Oktoberfest dancing and you're spinning around, you're dancing, you've got a great dance partner, but everybody around you has had a little bit too much to drink and they're bumping into you, then you might fall over. And so your ability to, when you're bumped into, to reestablish stability and get your dance moves back on is an example of reactive balance control. Or if you're walking and someone runs into you, your ability to, you know, reestablish stability. Or if you're walking your dog and your dog all of a sudden pulls on your, you know, because they see a squirrel, and you're able to reestablish stability instead of falling forward. So those are examples of reactive balance control. And so what does that look like? And so this is a video, and these are some very basic beginner type exercises. She's using a chair for support in some case, but the idea of doing movements where you're kind of shifting body weight and changing your body position so that you're slightly unstable and you're trying to maintain stability. So a lot of these examples she's got here are anticipatory control. This is a really nice one that she's doing right now, of dynamic stability as well as functional stability limits. So she's leaning forward and she's able to kind of shift her weight. And maintain stability even though she's at her limits of stability. So I'll play that again while I'm describing some examples. So anticipatory control and dynamic stability, things like sit to stands, heel raises, standing with one foot elevated, functional stability limits, reaching or weight shifting in all directions while standing on one foot or both feet, and reactive control, catching and throwing a ball or moving while standing on an unstable surface. So those are some beginner balance exercises and examples of ones in each of those categories. Now, if we were going to progress those exercises, so this is now versions of the foot taps. Now she's doing foot taps. That's a bit more challenging than what she was doing in her previous one. Now she's moving her arm position, trying to make it. Now this is great for back extension as well, using your arms in that position. You can also add step ups or lateral taps. Now we're adding some more difficult versions of the exercises to try to increase the challenge. But the idea is you make the exercises more difficult so that they're challenging enough for you. So you need to find the version where you feel a little unstable, but you can still do it without falling, right? So maybe you start with the beginner ones and progress to these harder ones, or maybe the beginner ones are hard enough for you. Or maybe they're way too easy and you need to start with some of these harder versions. And so one way is to rely less on supporting objects. So don't hold on to the chair or the counter as you get good at it, or close your eyes or turn your head while you're doing it. Add in arm movements as she's done here. Make it more dynamic. So instead of just standing on one foot, you could do toe taps on a bench, or you could walk while balancing on your toes or walk while balancing on your heels, or do even more challenging exercises that involve reaching or weight shifting, or doing complex dance moves using an agility ladder, doing shrimp squats. There's all different kinds of things you can do. The idea is you just progress the challenge. So I'll just get you to stop and reflect and think about what your balance is like if you're standing on one foot, or if you're standing in tandem, like standing heel to toe, or if you're moving around, or think about a time where you've become unstable because someone's knocked you over or done something. What's your balance like, and where are you at, and what would you need to do to do an exercise that is challenging enough? And then what balance exercises are you doing now at least 2 to 3 times a week? And what could you add or progress? So hopefully you can use some of these ideas to think of things to kind of either progress the program you're doing now or start a new program. So the second recommendation is doing resistance training at least twice a week. And my suggestion is, if you're not doing resistance training, a good kind of way to start is just to pick a handful of exercises that, address one certain movement category. So I like to think about movement categories. And the nice thing about these movement categories is they work more than one muscle group. So you don't have to do, one exercise for biceps, one for triceps, one for chest, one for like it's too complicated. If you do a push exercise, a pull exercise, a squat exercise, a hinge exercise, a carry, and a press or a reach, you pretty much have most muscle groups covered. And so you could start with something like that. And in fact, I do this workout at least once a week, just because I'm busy and sometimes I don't have time to do a big, long program. So I'm going to do a simple whole body exercise program that covers your major movement categories. And the trick is you just need to pick the version of the exercise that's challenging enough for you and then progress it over time. And so I have a table here. I'm not going to go through this whole table, but it just gives you a sense of, with each exercise category, there's a continuum of difficulty levels, and you just need to find the one that works for you. So for some people, a wall push-up is a sufficiently challenging push exercise, and it's going to work their chest and their triceps. Whereas for other people, it's way too easy, and they might need to do a bench press or a push-up on the floor to make it hard enough, right? And another example, there may be some people that find it really hard to get out of a chair without using the hands for support. So that's what they start with. They just do in and out of the chair, use the hands, and eventually don't use the hands anymore. And then eventually, don't use the chair, right? Whereas other people, getting out of a chair is easy, and they might actually need to start with a bodyweight squat holding a weight, because they need more of a challenge to get at that point where they're reaching overload. So if you recall, we talked about overload, where you work against resistance to a point where you can only do maybe 1 or 2 more. So it's about picking the exercise that is challenging enough for you in each of these categories. So I have an example here of what it looks like for squats. So here's an example where if you can't get in and out of a chair without using your arms, you can maybe put some pillows on the chair and just sit. So it's kind of like a high level, and then eventually take them away. And as you get stronger, you can take them away, right? And then you're sitting right on the chair and getting up. And then eventually you get to a point where you just tap your bum, or you take the chair away entirely and you just do a body weight squat, right? So that's now a bit more challenging. And then eventually you'll be able to add some weight to that exercise with or without the chair. So you could do the weights with or without the chair, but you can add. Now notice she's holding the weight really close to her body, not out front, really nice and close. Her alignment in her spine is really good. So she's keeping her spine aligned in a neutral position. And then eventually she can get to a back squat where she's actually squatting with weights. And so so for her, she's strong enough that she can actually lift this weight. And so that's the resistance exercise I choose for her. Whereas someone who had difficulty getting in and out of chair might need to do an easier version. So it just gives you a sense that there's a continuum, right? And you got to figure out where you are and try to progress along that continuum. So one way to approach that. So this is an example of a hinge exercise. So she's doing, you can see she's hinging at her hips. So she's not bending her knees. This is not a squat. She's hinging at the hips and bending forward. And the way she's made it more difficult is she's kind of doing it on one leg and using the other leg for balance. And she's added a resistance band. So how to design a resistance training program. So you want a push exercise, a pull exercise, a hinge, a squat, a carry, and a press. Start with that. And you want to have one exercise, pick a version of those exercises that you can do at least 6 to 10 times. It should feel hard. If it feels really easy, then it's not hard enough for you. Pick a different version, make it harder. And can work on form. So get, some information on how to do it with good form, and practice that form and really get the hang of doing the exercise. And then you want to progress to a version of the exercise where you can do 6 to 10 repetitions, but it really requires high effort. And so I like to use the idea of repetitions in reserve. So you want to pick a version of the exercise that you can do 6 to 10 times, and you only have 1 or 2 repetitions in reserve, meaning you can only do maybe 1 or 2 more sets before you cannot do any more. So if you can do 15, that means it's too easy. If you can do 13, it's too easy. If you can do 10 and you maybe have 1 more left in the tank, then probably that's about right where you want to be. Or 6 and you have 1 more left in the tank, that's probably where you want to be. You want to lower the weight for 4 seconds or lift for 2 seconds. So if you think about this, the lowering is when she's bending over and the lifting is when she's standing up. So she want to lower to a 1, 1,000, 2, 1,000, 3, and 1,004. So she's a little fast there. And then 1 and 2 and coming back up. So once you get good at it, you can progress your reps to a maximum of 12, but ideally I'd keep it 10 and under. And then add sets. So you can go, instead of 2 sets, you can go to 3 sets. You can even go up to 5 if you really want to. But as soon as you can do the number of sets you're planning to do up to 10 or 12 reps, then you should probably make the exercise harder. So here's some idea of how we align resistance training with functional activities. So you can see that carries can help you carry groceries, step-ups can help you bring things into the house. You need to be able to lift them to your counter or to your cupboard. You need to be able to get on and off the floor to be able to do things in your daily life. And you also want to be able to squat to pick things up off the floor, or to, I guess, feed your dog. Now you might be saying, oh, that woman looks really strong and fit. But this was actually a participant in one of our studies during COVID, where we were training people virtually. So we never met this person in person. At baseline, this was her sit to stand performance. You can see she needs to use a lot of momentum to get out of the chair. She really struggled to get out of the chair without using her arms. And after doing a strength training program for about 10 to 12 weeks, virtually. So we met with her virtually a few times, taught her an exercise program that she practiced, and you can see that her sit to stand performance has improved dramatically. She's able to get in and out of the chair with ease. There's very little momentum there, and she's using a lot of her leg strength. So it is possible to make improvements, and you just have to figure out, start where you're at, but make sure you're kind of working on form and continuing to improve and continuing to progress your program. A static program where you do the same exercises all the time, you're not going to see the same improvements. Now, I mentioned that if you want to improve posture, you want to target your back extensor muscles and your abdominals and your shoulder stabilizers. So if you include presses, pushes, and pulls as part of your strength training program, that will address the shoulder stabilizers, but you can add extra exercises to work on range of motion or shoulder external rotation if you have some impingement issues. This is a fun exercise. It's called a plank to push up. It's really hard. You may find it hard to do even a few of these. But you get into a plank position, push the floor away, make sure you're aligned, and then you actually lower down onto your forearms and then push back up. So this will work on your back extensors, your abdominals, your triceps, as well as your shoulder stabilizers. It's really, really challenging. Again, I'm not saying everyone should do this. You need to do it if it's within your ability, but that's an example of one that works those muscles. If you do have hyperkyphosis or exaggerated thoracic curvature, like upper back curve, you want to avoid holding too much weight in front of your body. So you might want to use alternative ways of holding weights or carrying groceries. So carry groceries one on either side rather than out front. Use a pillow underneath your neck if you're lying on your back to maintain a neutral spine, especially your cervical or neck, the neck part of your spine. Do exercises for your back extensor muscles or shoulder stabilizers, absolutely. You may also want to strengthen the muscles that extend the hip, like doing hip hinges or standing hip extensions, and also work on range of motion for your hip flexors. So taking long strides during your walks or doing lunges. So back extensor muscles, again, there's a continuum of exercises. So if someone had spine fractures and pain, I might just get them to lie supine. So that's the picture on the top there, with their knees bent and their arms out to their sides, and just kind of work on passive extension of the spine and stretching of the front shoulder muscles. And then eventually start with gentle presses of the shoulders into the floor. So for example, imagining you're on a beach and you're trying to make an impression in the sand by just gently pressing your head and shoulders into the floor. So that would be where I would start kind of at a beginner level, whereas a more advanced version would be doing a quadruped arm and leg raise or a bird dog, which is the picture on the bottom there, or doing thoracic extensions with a TheraBand, where you there's a variety of different types of exercises that you can do. So I have a picture here of, good form for the bird dog, and you can do this at a counter if you can't get down on the floor as well, or using a chair. So you want to push the floor away, make sure you keep your spine aligned, and the only things that move are your hips and your shoulders. You want to extend your heel out to the floor behind you and your arm to the floor. Notice the trunk is not moving, so my spine is not moving or arching. My hips are not rotating, and I'm keeping my spine neutral there. So again, push the floor away, extend hip and arm, actively extend the arm and leg. The hips face the floor, they don't hike up, and the torso stays stable. So notice my torso is not moving. I'm not arching my back. I'm not flexing my spine. The only things that are moving are my hips and my shoulders. If you do it properly, it's actually a really challenging exercise. If you want to add impact exercise, I would first start with strength training. You need to condition your muscles and tendons to get used to high force exercise. Once you've got a strength training program under control, you can start with low impact physical activity, heel drops, foot stomps, grapevine, fast-paced walking, step-ups, those sorts of things to add some impact. And then you can progress towards movements that change speed or direction, and then potentially start doing jumps, hops, low drop jumps, skipping, those sorts of things, and then higher jumps. However, if you're at high risk of fracture, you really need to proceed with caution, because there is the possibility you can increase the risk of fracture with impact exercise. Or if you have arthritis and it's painful, you might want to stick with the resistance training and maybe just work on exercises that change speed and direction, or lower impact exercise. So it really depends on the person and what's safe for them. So I kind of say, sort of progress the impact exercise with caution. Always start with strength training, condition your muscles, start with lower impact, and progress slowly with caution. And this is where an exercise professional can really help you kind of decide where you're at. If you do impact exercises and you're doing hopping and jumping and that sort of thing, the guidelines from Australia suggest doing it 3 to 5 sets, 10 to 20 reps, and with 1 to 2 minute rests. And I think that makes sense. But that wasn't actually part of the guidelines. This is just sort of me kind of giving you some practical parameters to use. The other thing I'll say is we don't want to avoid all bending and twisting because that's not really practical in the real world, but you might need to modify activities that are high risk. So as I mentioned, twisting your spine quickly, twisting over and over all the way, bending forward quickly over and over all the way. And that's when you're flexing your spine. So you can see in the little animation I have there, they're bending with a neutral spine. So that's okay. That's good alignment. So if you do bend, you want to bend, keeping your spine neutral. So they're using a dowel along the buttocks, shoulders, and head to try to kind of keep their spine straight. And that's kind of how we want to bend. What we don't want is flexing the spine. Or we don't want combined twisting and bending, or twisting and bending the spine while holding something heavy. So you want to bend at the hips, knees, and ankles rather than rounding the back. You want to hold things close to your body or divide the weight equally in each hand. So I know when I go grocery shopping, you know, the inclination is to hold your keys in one hand and 5 grocery bags in the other. But what you want to do is actually divide the grocery bags between your hands so that they're balanced, because that will be less forces on your spine. You want to use a log roll and your arm strength to get out of bed. And make sure if you're turning that your trunk, knees, and toes face the same direction. You want to use slow and controlled movements and look for resources to give you some guidance on how to move. I did get some questions about yoga. So I will say that, like, if you enjoy doing yoga and you want to do it for, you know, health reasons or other reasons, that's fine. We don't recommend, it's not recommended as in the guidelines because there's not as much evidence around its effects on falls or bone density. So that's why it's not up there in the recommendations. But if you enjoy doing it and you want to do it in addition to the balance and strength training that you're already doing, make sure you do focus on controlled movements rather than pushing the intensity or trying to maximize your range of motion. So rather than forcing a posture, do a controlled movement to a place that you feel safe in. Be mindful of how you move during transition. So in one of the studies of exercise in people with spine fractures, someone fractured a costal cartilage while rolling from supine to prone. So that means like rolling from being on your back to your front. And so it's sometimes the transitions, like picking up the weights or dropping weights on your foot or rolling, that you can actually hurt yourself. So you want to make sure you use controlled movements and be mindful of how you move. You also want to think about modifying a pose if it involves a lot of forward or lateral flexion or twisting of the spine, especially if it's unsupported, like if you're bending all the way forward and not supporting your weight, or if it's at the end of the range of motion. You can consider support objects like a chair or yoga socks for traction, and talk to your instructor about tailoring it to your fall and fracture risk and ability. And so here's some examples of poses. So the one on the far left is unsupported and sustained spinal flexion. So I would not advise a pose like that. I would not advise hyperextension of the spines where you're extending backwards a lot. This one on the middle bottom where they're twisting to the end range of motion and they're kind of forcing it with their arms in that position, and they're standing in an unstable position. So this would be one that I would probably modify unless you feel you have the ability to do it. And finally, the one on the far right is involves spinal flexion and a lot of pressure on the cervical spine, so probably not one I would do if you're at risk of fracture. I'll also mention that we have a tendency when we, to think about weight loss for health reasons. And I really want you to focus on balance, strength, and physical functioning rather than fat or body weight. If we're trying to lose weight, or if we're losing weight, we're losing fat, muscle, and bone. And we want to try to avoid losing muscle and bone. So we want to eat enough protein, enough calcium, enough vitamin D, enough calories to maintain our weight and to build strength and function. If you're trying to lose weight, that's fine. Make sure you do resistance training, because resistance training will help prevent the bone loss and the muscle loss that occurs with weight loss. And make sure you're getting adequate protein to hold on to that muscle. It's ideal if you can consult an exercise physiologist, kinesiologist, or physical therapist with strength and conditioning expertise to design your exercise program or give you some advice on how to move safely or do the things you want to do safely, especially if they have knowledge or training on osteoporosis or bone fit training. You ideally want to pick someone who has experience working with people who have similar goals and abilities to you. I would suggest avoiding people who are selling hormone tests, supplements, or restrictive diets, because that suggests they're not using evidence to guide their practice. And then look for resources that are available in your community. So if you have arthritis, there's the GLAD program. Osteoporosis Canada has lots of resources online, and we have a new booklet coming out soon. So look for that. You can look for someone who's bone fit trained if you want some guidance on how to adapt your exercise program, and also look for falls prevention programs or Tai Chi programs in the community if fall prevention is of interest to you. So in summary, we recommend balance and functional training at least twice a week. You can do balance training every day, which is great if you can. Strength training at least twice a week. Do other activities for fun and fitness in addition to, but not instead of, balance, functional, strength training. You may need to modify or avoid certain movements, especially if you're at high risk of fracture. And when available, seek advice from exercise professionals who have training on osteoporosis. I'll mention that we have the Bones Lab, or the Bone Health and Exercise Science Lab, has an email list. We send out information about new studies or new information and guidelines. We don't send emails too often, but every once in a while we'll send one out. If you'd like to be added, please email boneslab@uwaterloo.ca. We are also on social media. So some of the clips that I showed you are on our YouTube channel. You can subscribe to our channel. You can also follow us on Facebook, where we post information about new studies and other things. And we are recruiting for a study. It's called the Fortify Bone Study. If you are interested, we have sites in Saskatoon, MARCOM, and Waterloo, and we are recruiting. We have spots for about 20 more people. So if you're interested in learning more about the study, you can you can either email us at boneslab@uwaterloo.ca. There's a QR code there that will link you to more information about the study, or you can just Google Fortify Bone Study and you'll find a summary of what the study is all about. So with that, I can stop and answer questions that you may have.
Thank you, Laura. That was amazing, very informative. I'm going to actually answer the first question because we were getting this. Yes, this webinar is being recorded, and yes, it will be sent out to all the registrants. It will also be available on the OC replay page tomorrow. So don't worry, if you want to rewatch this or share it with someone else, that would be great. So my first question for Dr. Giangregorio that we've got: is it true that exercising in very short spurts is actually better for bone health or for those living with osteoporosis?
Is it true that, sorry, can you repeat the question?
Is it true that exercising in very short spurts is actually better for bone health or those living with osteoporosis?
So there are animal studies that suggest that doing short bursts of exercise are more osteogenic, if you will, than doing longer bouts of exercise. But those are animal studies. Unfortunately, we don't have human studies where they've done a lot of short bouts of exercise compared to long bouts. I can say that there was one study where they had people doing short bouts of hopping, and they reported improvements in bone density, but it was a very small study. And we do know that people who do endurance sports like cyclists and runners tend to have lower bone density. Now, I think part of the reason for that is they expend a lot of calories, and it's advantageous for your body to adapt a lighter weight. So I think part of that is they may be losing weight and losing bone. But yeah, certainly running doesn't necessarily prevent you from losing bone. So I do think that there's something to be said for kind of making a habit and doing exercise every day, even if it's shorter bouts. And I do think, although there's not as good clinical trial evidence that probably impact exercise may be important. So I would say, like, I think it's a continuum. So I think biggest bang for your buck in terms of fracture prevention is making sure you have good balance and you're not falling. So that's step one. So you should be doing balance training every day. Then I think it's really important to maintain or improve your muscle strength. And so if you can get resistance training in 2 or 3 times a week, important. And then do the resistance training to condition your muscles to be able to tolerate impact exercise. And then once you've got that under control, you can layer on, if you like, if bone density is important to you, impact exercise. And I would do the impact exercise in short bouts as recommended in the presentation. So like, you know, doing 10 or 20 repetitions, 1 or 2 or 3 sets. That's it. You don't have to do a lot of it. But I think starting, it's sort of start with the balance and functional training, then make sure you've got the resistance training in, and then you can start layering in the short bouts of impact. So hopefully that's helpful.
That's great. We actually have quite a few questions around aquatics and swimming, and really the role that can play in exercise for bone health and fracture prevention.
Yeah, so swimmers tend to have normal or lower than average bone density. So I don't think if your goal is improving bone density, swimming's not it. I think the problem is you're unloading bone when you're in the water, right? So there's not studies in people with low bone mass looking at swimming as an intervention, but I would say that if you look at studies looking at bone density in swimmers, they don't necessarily always have higher than average bone density. So it wouldn't be my activity of choice if I was trying to improve bone density.
Great. All right. So here's another question. Are there exercises that are contraindicated for those with osteoporosis who have been very active before their diagnosis? For example, forward flexion moves like curl-ups, back squats, or high impact movements such as tuck jumps.
It's really hard for me to say yes or no, you can do an activity, because it's not like there's studies where they randomize people to tuck jumps or no tuck jumps and see if they fracture, right? So what I can tell you is that as your bone density gets lower, your fracture risk gets higher. If you've had fractures, you're more likely to have one in future. So you have to kind of understand what your fracture risk is, and then figure out, and then there's going to be that continuum of risk. So for example, with sit-ups, it does involve spine flexion. So there is a risk associated with spine flexion. So if your spine bone density is really low, or you've already had spine fractures, you probably should not do them. If you don't have those, you might be able to do them safely. I would do a curl up rather than a sit up. I don't think sit ups are a good idea for anyone, to be honest with you. But because you can do curl ups and still achieve a good ab activation. But even still, there are other exercises that don't involve spine flexion that you could do first. So I would probably start with planks and side planks and work on good abdominal endurance before you start doing curl up. So again, there's that continuum of, that's a more advanced exercise. So it's not something I would start doing. I would do other exercises first. And the same is true for tuck jump. So I think I talked about my approach to impact exercise would be, you really should be making sure you're doing strength training and your muscles are conditioned. And then you want to start with lower impact exercises. And then you might want to work on exercises that involve changes in direction or changes the speed of the movement, then kind of gradually increase the level of impact before you're getting to something like tuck jumps, right? So, and it might be that for people at high risk, tuck jumps are too much of a risk. So it's about kind of conditioning your body along that continuum, and you may get to the point where you can do tuck jumps safely. But there is always a risk when you have low bone density that something can increase your risk for it. What was the other example? Tuck jumps, sit-ups, what was the other one?
It was curl-ups, back squats, or tuck jumps.
Yeah, so back squats is something where I think many people with low bone mass could do them safely, but we don't start people with back squats. We usually start them with body weight squats, then goblet squats, or squats where you're holding the weights on either side of your body, like dumbbells. And then eventually, once you get to a certain weight, you might be able to start with back squats. But people who are really high risk or have existing vertebral fractures, they may need to do other types of squats because the loads associated with putting the bar on your back might be too high for some people. So again, it's about, what your risk is and what risk you're willing to accept. And where you're at. Like, I wouldn't start with back squats.
Perfect. Okay, that's great. We've got a couple more questions. How important is it to keep increasing the amount of weight lifted?
Um, I think it's not so much the amount of weight lifted, but how hard the exercise feels for you. So, because you can increase the challenge of the exercise without adding weight. So the first thing we do is make sure people are doing the exercise with good form. And then what we do is we look at the speed that they're doing the exercise. So people often do them really fast. And I would say you want the lowering phase to be 4 seconds and the lifting to be 2 seconds. So as soon as we force people to do it with that speed, all of a sudden it feels a lot harder, right? Then you can add weight or you can change the way you do an exercise. So for example, let's say you can do body weight squats. I might switch you to a split squat or it's kind of like a lunge in when you're standing where you just go up and down. That's harder than a bodyweight squat. And so that's a way to make the exercise harder without adding weight. So for people who are concerned about adding weight or lifting weights, they can change the way they do the exercise to make it harder. So either change the speed or change your body position so that it's on one leg instead of two or that sort of thing, to make it harder. If you are finding that you need to make it harder by adding weight, you can gradually add weight. But yeah, sometimes people get to a point where they're like, okay, I don't really want to be lifting any more weight, and that's okay. But it's more about the how hard it feels for you. So again, it's a version of the exercise that you can do 6 to 10 times, and you maybe have 1 left in the tank or 2 left in the tank, and that's it. So that's kind of where you want to be. So it's not so much about the weight you lift, but how hard it feels for you. The other thing is the range of motion. So sometimes people will do squats, but they don't squat very deeply, right? So they only squat a little bit, and they might, we usually try to get people with their thighs parallel to the floor. So it might be that once I get you squatting with your thighs parallel to the floor, it feels a lot harder. You don't need any weight, right? So rather than increasing the weight, you might squat a little deeper. So there's ways of doing the exercise differently to make it harder.
Okay, wonderful. All right, we've got, this is actually, we've had a couple of these questions. So are there limitations when someone has fractured a vertebrae? For example, is running a secure activity if you have several vertebral fractures, in a year or however long? Is it a good idea to try to resume training, or is it just better to kind of move on to something else?
It's a really tricky question. I'd probably need a lot more information. So the first thing would be, what was the cause of the vertebral fracture? So if you had the vertebral fractures during running, I'd probably say it's maybe not a good idea to continue. There is that impact associated with running. So there is that risk that you could increase the risk. The other thing I would ask is, are you on medication? Have you started a strength training and balance training program? Because maybe get those in place first before going back to running, and making sure that you're getting adequate calories, adequate protein, adequate calcium. Because again, if you're losing bone or having fractures because you're inadvertently under eating because you're burning lots of calories running, then starting running is going to be problematic, right? So I think there's addressing these underlying factors that may be contributing to your fracture risk before you restart running. So building muscle strength, making sure you're getting enough calories and calcium and that sort of thing. And then you got to have a conversation with your physician about, what was the cause of your fracture? Would it be safe for you to run? And also, how much do you love running? There's lots of factors you need to consider. So if you're doing other things to reduce your fracture risk and you're having a conversation with your physician, they think it's safe for you to resume running, then it's okay. But I would also consider conditioning, maybe doing things to reduce the impact, like running on surfaces that are less hard, having good support in terms of shoes and impact and that sort of thing. There's a lot of things you can do to reduce the risk, but it's hard to say a yes or no answer.
Okay. Oh, so
Um,
Dr. Giangregorio, keep going.
That's it. I see
Oh,
a lot
that
of
was it.
questions
Okay.
in the chat.
Okay. I know we've got so many questions, and we're getting questions on very specific forms of activity and exercise. So just like we're recording this webinar, we've recorded many others. On the OC replay page, you can find previously recorded webinars on, we've we've grouped them, winter activities, summer activities, where we talk about, modifications, etc. We've also put the link to the Too Fit to Fracture information webpage, and also you can download the PDF. It's in the chat. And right now we just are going to wrap up. I want to thank Dr. Lora Giangregorio for this amazing presentation. I'm just going to continue to share. I'm just going to pop my screen up here. Definitely do that. So we want to thank everyone for their questions and their information. This was really, really robust. We also want to thank our partner, the Collins Stevens Family Foundation, because they help us get programming like this out to you. If you enjoyed this webinar, we have lots of other programming coming up. So we also have some in-person. So if you're in Toronto, October 28th, we've actually got an in-person nutrition and cooking demo. All the information is on the website. You may have also received information about a webinar next week on a biosimilar for patients on denosumab. So that's Thursday, October 24th. And if you are in New Brunswick, in and around the Riverview area, we have a bone health event in person in English and in French. That is on Thursday, November 7th. So all of this information is available on the website, along with a lot of other information on exercise and also previously recorded webinars. We want to thank you, the people who are joining us, because that really, this is who we're doing it for. If you'd like, you can subscribe to the National e-newsletter. It's on the top right-hand corner. Give us your information and you'll get it directly to your inbox. You can also follow us on Instagram and Facebook. And again, just a thank you to Dr. Lora Giangregorio. Wonderful webinar, everyone. Thank you so much for all your questions. Stay tuned for more information that will be coming out. Have a wonderful rest of your day. Take care, everyone. Bye-bye.